Hello gang, it's Evelyn here. Today I'm going to talk about CKD, which is chronic kidney disease. The reason why I chose this topic is because I've had people ask me to talk about it. Plus, I have family and friends that actually have the disease or passed away from this disease. So I kind of wanted to bring an awareness to it and also letting people know how to prevent it or how to manage it if you do have the disease already. What is CKD? First of all, I want to talk about some statistics about CKD. Do you know that 10% of the global population have CKD? And CKD is the 18th leading cause of death globally. Also, 1 in 10 Canadians have CKD. That is 4 million adult population in Canada. In the US alone, 1 in 7 people have CKD. That's about 37 million adult population. CKD is a silent killer. And because it's a silent killer, most of these people do not know that they have CKD. Which is why the best way to know that you have CKD is to follow up with your GP to get yourself checked. Diagnosis for CKD is through blood work or urine test, which I will discuss in this video. What is CKD? CKD is either a damage to the kidney or loss of kidney function that has been occurring for more than 90 days. So that means your kidney has not been working effectively the way it should have for more than 3 months or 90 days, hence chronic kidney disease. What does the effect of chronic kidney disease do in one's body? And how do you know what kind of symptoms would you have? The only way to find out is to know what the kidney does, the function of the kidney. So I'm going to talk about the function of the kidney. First of all, where is the kidney? The kidney is a bean-like shape, the size of a closed fist, about 9 cm long, that is located in the upper part of the rib cage. So the kidney is supposed to filter metabolic waste such as urea, excess creatinine, excess sodium out of the body to make urine. They also produce different kinds of hormones. One of them will be renal. So what renal does is that it regulates the blood pressure. It also does sodium water balance in the body. So the renal is supposed to increase your blood pressure when they sense that your blood pressure is low. So what they do is that they reabsorb sodium and water back into the cell so they can increase your blood volume. Once they increase your blood volume, they increase your blood pressure. That's what renal does. They also release another hormone called angiotensin. What angiotensin does is that they also increase the blood pressure because it senses that it's low blood pressure. So they do bring sodium, potassium back into the cell reabsorption, so that way you can increase the blood volume, increase the blood pressure. That's how that works. Another hormone that the kidney releases is called erythropoietin. Erythropoietin is used in making red blood cells. And what the red blood cells does is that they carry oxygen from the lungs to all part of our body. So you can see why if you don't have enough oxygen to all part of your body, you're going to end up with low energy, you're going to be weak, fatigue, it can lead to anemia. So chronic anemia for a long period of time can lead to bone abnormality. So when you have a damage to the kidney or loss of kidney function, you can think of fluid overload because the kidney cannot filter any of those fluid anymore. So you're going to end up with fluid overload. You're going to end up with hormones that will not be produced, so your blood pressure is going to be always typically low, and then you're going to end up with too much potassium in your body. You're going to end up weakness, nausea, all kinds of symptoms that the kidney cannot do. So what are the risk factors for CKD? One of them will be age. As you age naturally, so is your kidneys. So the more you age, the more you lose the ability to produce nephrons. The kidney is made up of millions and millions of nephrons. So the more the nephrons are reduced, that can also cause loss of kidney function, which can lead to chronic kidney disease, right? Because the kidney is not able to filter effectively the way it should have. So that's what age does. Second one would be race. Latino, African American, Asian, Native. It said that they have more risk factor because of their race. Another one will be high blood pressure. So if you have high blood pressure, there's a risk factor that you will develop CKD. Another one would be diabetes, too much excess sugar in your bloodstream. Another one would be smoking, obesity, family history, which means that there's a disease called polycystic kidney disease that is inheritable. It's caused as a result of cysts that develop in your kidney that can lead to chronic kidney disease. Another one will be heart disease and stroke. Another one will be tobacco use, smoking. It's not good. Alcohol use, all those are the risk factor for CKD. Now that I've talked about CKD, I want to talk about the two main causes of CKD that I really want to talk about. The first one, the primary one, which causes about 46% of the cause, is diabetes, specifically diabetes type 2 specifically. When there's too much sugar in the bloodstream, what's going to happen is that it's going to change the blood chemistry. So what happens is that the blood is going to get thicker and the blood flow is going to reduce. It's going to reduce the blood flow. I think I mentioned that before. Another thing that it does is that it also hardens the artery, called arteriosclerosis, where it damages the vessels of the heart and renal arteries, so that way those vessels are not able to move fluid the way they should have. So in that way, it decrease the cardiac output. Cardiac output decrease the function of the kidneys. And diabetes also weaken the blood vessels, and all of this overall can cause the arteries of the vessels to become weakened and damaged, and this is no good for the kidney. And what's going to end up happening is that you're going to lose some kidney function. Another one would be hypertension, high blood pressure. Elevated blood pressure over time what it does is that it hardens the artery as well and weakens it as well. So over time, the kidney is going to lose the ability of an efficient vessels that should move fluid to the kidney. They can filter it. In that way, if that doesn't work, the filter will not be able to filter effectively, and this can cause chronic kidney disease. So those are the two big ones, really. So what are the signs and symptoms of CKD? One of them I've talked about, it's fluid overload. So you're going to have fluid in your ankles, in your leg, because the kidney can no longer filter the stuff, and all you do, you're going to have fluid overload everywhere. Fluid in your lungs, you can't breathe, you start having shortness of breath, fluid in your vessels of the heart, you start ending up with even CHF, and also end up with itchy skin. You're going to end up with difficulty in sleeping. You can't sleep at night. You're going to end up with just being tired. Remember, I talked about the RBC carrying oxygen to other part of the body. So the kidney is not able to produce that hormone, that erythropoietin hormone that produces RBC that carry oxygen to a part of the body. You're going to feel tired, low energy, and you're going to have loss of appetite, so leading to loss of weight loss and all that stuff. So the kidney is actually an important organ, so maintaining it is very crucial. So now that we've talked about the signs and symptoms of the kidney, I'm going to talk about the tests for diagnosing CKD. One of them is the urine test. When you go to the doctor, they ask you to pee, and they tell you, oh, there's a protein in your urine, there's blood in your urine. It's a sign and indication that you have chronic kidney disease. And the reason being that the kidney does not allow large molecules like blood or albumin to pass through. They do only allow small molecules like inorganic iron, water, salt, all that to pass through. So that's how you know you have some kidney damage. The second test is a blood work test. So they check your creatinine. Creatinine is the waste product of muscle breakdown. So you're supposed to have less creatinine in your bloodstream. So if you have elevated creatinine in your bloodstream, it means that you have some kidney damage. So the lower the creatinine, the better. So the normal value for creatinine should be between 0.7 milligram per dl to 1.3 milligram per dl, which is about 62 micromole per liter to 115 micromole per liter. Third test is a glomerular filtration rate, GFR. In your blood work, it could be seen as eGFR. This measures the efficiency of the kidney to filter blood plasma in milliliters per minute. So which means that the higher the GFR, the better your kidney function. So if you have a GFR of 90, that's good. And if you have a GFR of 10, that means your kidney function is done, is lost. So it is the GFR that is used in describing the stages of kidney damage. The first stage, stage 1, it's when your kidney function is about 90 milliliter per minute, which means there's a slight damage. It could be none or in this stage, you typically will have a normal creatinine, but maybe you do have some issues with your kidney, like an problem with your anatomy of how the kidney is made, or you have some inheritable kidney disease. Even though you have your creatinine is normal, they can stage you at 90. So that's like slight, nothing big deal. Most in this case, people don't have any symptoms at all. So stage 2 of diagnosis of CKD, your glomerular filtration rate, GFR, is about 60 to 89. In this stage is mild. Most people don't have any symptoms in this stage. But if you are a person that have high blood pressure and diabetes, I would recommend that you follow up with your doctor to help manage this at this time, because if you don't manage stage 2 very well, it can actually lead to stage 3, which is moderate symptom. So it's very crucial that you maintain stage 2 very well. Stage 3 of this stage of CKD, your glomerular filtration rate is between 30 to 59. In this stage, you're starting to feel symptomatic. Some people don't have symptom in this stage, but people who have symptoms, you start to get tired and you have low energy. You start to develop fluid in your legs, edema in your ankle. You start to have elevated potassium, elevated phosphorus, bone abnormality, anemia, because of the lack of production of red blood cells, like I mentioned before. In this stage, it is important that you follow up with your doctor in this stage. Stage 4 is more severe. GFR is about 15 to 29. In this case, you're starting to develop all of the symptoms that I explained in stage 3 and even more. You're starting to increase potassium, abnormal pH value in your blood become acidic. You're just feeling tired. In this stage, I recommend that you talk to your doctor so they can refer you to a nephrologist. In this case, you can still use part of your kidney. At this stage, some people don't really need hemodialysis or peritoneal dialysis or kidney transplant. You can still work with it. All you have to do is manage your diet in this stage, talk to your doctor, ways they can recommend in order for you to manage your kidney effectively. Stage 5 is when your GFR is less than 15 mils per minute. In this case, you know that you have kidney failure. In this case, this is the stage where you follow up with your nephrologist, where you can get renal replacement therapy by getting hemodialysis if you choose to do that, peritoneal dialysis, and kidney transplant, because there's no way to save that kidney. One thing about a kidney cell is that once you lose part of that cell, it's gone forever. You cannot replace it back. So which is why it is important that we take care of our kidneys. So the best way to prevent CKD is to follow up with your doctor regularly if you are a person with a high risk factor, and other things, and changing your lifestyle, diet, exercise, checking your blood pressure regularly to make sure it's not elevated. Take medication that can help to treat those things, diabetes, treatment as well. There's diets and medication to do that, because the two big risk factor for developing CKD is diabetes 46% and hypertension 26%. So take care of your body. Thank you.